That's a brilliant PR campaign Punjab government has launched.
Okay.
And that PR campaign tells us that whatever measures have been taken, they are taking.
I think you should go to a patient
but when you go to the hospital,
just recovered from his
in Ganaram hospital, there are only 175
I'll take you to some poor localities.
No, that's where we are all the time.
Speaking of the poor,
I don't doubt that. I don't doubt that.
That's where I get my figures from.
But I'm willing to take you.
Mr. Malik, speaking of the poor people, I'm sure you would say that your government here in the Punjab government directed all the private laboratories to charge a standard 90 rupees for the CBC testing, but that in itself became a challenge for the government to cope with, because there were calls for strikes and medical lab owners were saying that it is impossible for them. Just let me finish. And the PMA, the Pakistan Medical Association, has demanded that the Punjab government withdraw cases against doctors and laboratory owners immediately and deal with the dengue fever patiently. So there is so much.
Waqas, let's be very practical. You know, this load on testing, CBC testing, was getting very high. You know, so we wanted to supplement the test capacities. What we did is we arrived at a figure of the cost of this, which came to 70 rupees.
Are you going to provide some kind of subsidy for this, or?
Oh, if need be, we will do that. Not to these people. You know, when they are charging 70, it costs them 70 rupees. I think 20 rupees profit is reasonable for an emergency sort of a test.
Okay,
and it's on people who can't pay.
Even if you agree on the 90 rupees figure, Mr. Malik, has the Punjab government been successful in implementing these kind of measures that it has called for? Because there are calls for strike, and
let
me tell you, all those laboratories who are charging more than 90 to poor patients have been we have a regulation to close them, and they have been closed also. And we are telling them to please come to 90 rupees where you have some profit. Don't charge a poor person who wants to come as 300 rupees, what they were normally charging.
So this is an amazing way to deal with
we call
we say, oh, people don't have bread, why don't they eat cake?
We call the laboratories. I personally dealt with those laboratories people also, and we motivated, and most of them agreed that all right, this is a very reasonable figure. And then you have people who don't agree to this.
I also know.
We talk to all these doctors also.
Only public hospitals.
We all private doctors. The Chief Minister met all the huge crowd of private doctors, PMS.
Only public hospital laboratories are abiding by this.
So if somebody is going to be decided here, perhaps
I'm sure
the health secretary should resign.
Look at
health minister should resign, but there is no health minister.
Apart from the public,
he's saying that Punjab government is harassing us. We are not going to bring it down to 90 rupees.
He's already brought it.
Well, but just
already
PTI has been criticizing PML-N and asking for the
PMA is saying
there's been a call from PML-Q also. Lots of
two laboratories were closed down today.
When you take
a strong action, let's not close down the laboratories. Let's take whatever help we can get.
When you take certain action, there's always some opposition.
And one of the patients I saw in the news broadcast go all the way to Islamabad because hospitals could not accommodate him here. Of course, that's a story of 2-3 days back. But Rizwan, coming to you.
But you see, now we have engaged charitable hospitals, we have engaged
other hospitals,
we have engaged private hospitals,
and all this
you have every hospital, every private hospital voluntarily has allocated around 30% of their capacity.
All this wouldn't have been needed
to deserving poor patients.
So you don't have a complaint from people. You were saying that
all this was not needed if we were prepared.
We are increasing the capacity. Then you have then you have gaps. Some don't have machines, some don't have.
If we had sprayed the areas, if we had
and we are trying to fill all those gaps,
this wouldn't have happened.
Thousands of rupees, Rizwan, there are reports, were being charged by the private hospitals, and I'm bringing up this point because this is a disease that is spread in posh localities also. It's no longer a disease of the slums, as one could tend to attribute going by the way it is spread, the stagnant water, and also it's spreading in posh localities also. And so people from those localities, of course, will never go to Services Hospital here in Lahore or perhaps Jinnah Hospital. They would want to go to some better facilities, unfortunately, in the private sector. So what have you seen there? How are they coping with that? Are they, making an opportunity out of it and getting some commercial gains?
Definitely, Waqas. I would not name them for obvious reasons, but I have been to at least 3 to 4 private hospitals which are very leading and which are very famous here in Lahore. and they do not have any facility for any free thing for anybody. I mean, even if you ask, that they said that we have not been notified yet by the government to do that or do just this or do that, because the patient who come to those hospitals anyway are prepared to pay them whatever they are demanding from them. And I have not seen any poor patient going to them and saying that, okay, get me tested in 90 rupees. And even if somebody had gone there, my information is that very few people, those private hospitals which are in the slums area, so-called slums area, or on the congested parts of Lahore, they are perhaps providing few patients the 90 rupee testing thing, but most of the private hospitals, they are not providing anything, and they are not,
they're charging more money.
They're charging more money, one thing, and they do not want to, because
and
they said that we don't have.
Does your government plan to intervene in
you
this?
should be telling them not to take aspirin, not to take more
I wish I could have brought him to that meeting which I chaired with all these private hospitals. We made an understanding with them that about 25% to 30% of their capacity, the total hospital, it's not 100% dengue hospital, it's 70% for other activities also. It allows 25%, 30%, they will treat, and we are monitoring it. We have inspectors going and monitoring that the beds they sort of agreed with us. Are they following that? Are they trying anything extra? And most of the private hospitals are providing OPD service along with CBT testing free of charge to poor patients.
All right, and since we're speaking of prevention, Dr. Buttar, I want you to speak in the capacity of a medical practitioner. Do you think it's a good idea? Of course, you just, like Mr. Malik said, that one should not expect everything from the government side. Do you think that Lahore should be on an announced day sealed off, and a fumigation campaign should be done in the entire city so that this fever cycle could be broken? On one announced day dedicated to fumigation in Lahore, could that help?
No, I think that it's only going to lead to the panic mode that's already stricken there. Like I said, all this really is 90 days too late. Right now, what
so
we
you're
need
saying
to...
that now nothing can be done?
No, what I'm saying is that instead of closing the schools for 10 days and children are sitting at home and doing nothing, we could have done it in a more systematic manner, and we need to tell people, don't panic, just get like they're spraying the areas and continue to do it area by area, and also tell people that if you have fever, every fever does not mean dengue fever, but these are the symptoms you should be aware of. If you have them and you're critically ill, then you need to go to the hospital, and we should set up camps at UC level of healthcare professionals.
There are always lessons in the problems that we face in life, and perhaps it is an eye-opener for our authority figures that that they can make an assessment of the bad state of basic health that's available to our people in the country. Plus, we'll have some advice for you on how to take care of yourself. And also we'll have some questions for Mr. Malik on why does the PML-N think that it's the media frenzy that has occupied the minds of the people. Stay with us, we'll be right back. Welcome back. You're watching Witness with Quatrina. I'm filling in for Quatrina Hussain tonight. We're focusing on the problem of dengue that has gripped Punjab and has spread its wings to other provinces also. The death toll for today is 4. 3 here in Lahore, 1 in Sheikhupura, and out of the 7,000 to be very exact, that have been infected here in Punjab, 6,600 belong to Lahore. And why is that? Mr. Malik, why would the urban centre such as Lahore, the most modern city in the province of Punjab, be infected so severely with dengue?
Well, as I said before, this is a very unpredictable sort of disease. It can move to any city. It doesn't. The mosquito doesn't fly. It is a person who is infected with this disease, and if he moves to another place and some mosquito bites there, then this disease travels. So God has been kind that we are very lucky that it has spread very minimally to the surrounding areas.
There's some issue here in Lahore because last year
probably we had a lot of breeding in Lahore.
All right.
And you know, the breeding phenomena is a little surprising, that the eggs can be there for 1 year.
Has it served as an eye-opener on cleaning the nalas that we see in the city and all of that? Improving the general state of cleanliness
more of
in the
clean
city.
water is an issue, you know, more of a clean water. Then you have trees, you know, you have holes in the trees, it breeds there. Then you have so many other places also. So we are now focusing, what the Sri Lankans have advised us. Fogging, as you were saying, you know, we cannot have too much of fogging because it's again injurious. It's diesel based. It's diesel based. So there is a guideline for that every one house or one street should be sprayed fogged after about 3 to 4 days. That's the frequency.
That's the
and you know, we had only 46 foggers last year. Now we have ordered 400, and today we have about 250. So some are more coming, you know. So we are building our capacities on fogging also, that we have to attend to large places like Shalimar Gardens, Jangir Tomb. You know, all these places are breeding places. They are huge places. We have, and we closed the schools only because we found this breeding eggs in there. Sri Lankans found them, and then we had to shut them so that we can spray everybody. And the second round of spray is starting from tomorrow of all these government schools.
And where will that take place?
From tomorrow for 3 days we are going to have that, and then we are going to reopen the schools after that when we are sure about that. But these private schools, you know, we are asking them to spray their own premises, and only 50% of them have done it. We will request through you.
Schools that charge
we met them. We called all the private schools today. We met them and requested them. We begged them to please. We will only open those schools.
Are they listening?
They are listening, you know. They are listening, and we have told them that we will not permit any school which is not certified.
I said in the beginning that
dengue.
The Sri Lankan government said that they would jail people who would not clean up the puddles. Would your government take any such measures here? Because many of the people
what
here
is
are
the
very
difference
influential,
also,
the
that they have
instinct.
already have a legislation on public health issues.
We don't have that.
We don't have that. So that's the difference. That's what we have learned also.
Many lessons in this episode, Dr. Buttar. Do you think?
These are opportunities. You know, these are opportunities that you can put your system right.
What do you think? Are we going to use these opportunities? The state of basic health that is available to the poor people in the country.
When you say we,
I mean, all political parties.
Now we have decided to man the primary healthcare system. You know, we had 170. I'm telling you, dispensaries. Each of them are going to, you know, have a CBC machine at least. For times to come. So that we are developing government's capacity also, and then OPD services from these dispensaries, some beds also. So we've learnt a lesson again, that we are going to upgrade our primary healthcare system.
Problem with Punjab government is, the current Punjab government is, that public health representatives have no say in how things are being done. It is Mr. Chief Minister, who
I'm part of the team.
I'm part of the team now,
people, sir. I've been always, even last year, floods everywhere. I've been always an emergency companion of the government.
If we had public health representatives
having
a say in Punjab Assembly, we talked about it. We said dengue fever is going to come in. We don't have a health minister.
There was lots of criticism on media, and I just want to focus on that. I mean, media is just trying to do its job, being a part of media.
No, media, you know, the priority for media should be to educate people.
So that's what media is doing. I think media is...
Rizwan, why have representatives like you, why have representatives like you been misreporting, and you are being held responsible for the fear that is now, that has gripped people here in Lahore in particular? Because I just saw a woman the other day in one of the fast food joints rubbing, you know, mosquito repellent on a toddler of hers. So you've been misreporting, haven't you?
Yes, yes, I plead guilty to that I have been misreporting. The problem is that when the governments, the politicians, when they see that their media is projecting whatever is there on the ground, and their talk is not very convincing, sounding convincing to the people, the first reaction of them is that, oh, media is basically negating them. Media is trying to undermine them. In fact, media is not trying to undermine them. I mean, they are themselves undermining them by not reacting to a situation. So that when that thing comes, I mean, you think that it will be all over by a political talk, you know? I mean, these outbreaks can come,
this
and
was
these
the
outbreaks
topic
can
in
go.
the assembly also,
Yes,
Punjab
it can
Assembly,
be,
as a matter of fact.